with that said, let's get started. All right, please tell me if you can see my screen. Just a nod would be fine for whoever has their video on. Are you able to see my screen? Okay, perfect. All right, thank you. All right, it's great to see so many of you. A lot of my patients, a shout out to you guys for coming, and hopefully we'll get to chat a little bit after this talk is over. I want to start with the preface that a lot of you know a lot about your heart already. And even though you think you don't, you really do, because you've lived with it for most of your childhood and through your adult life. And I just wanted to start us off by really doing a little bit of centering. We all may have had a rough start to the day, or maybe had a moment where you kind of slipped up and lost your cool, or maybe you had a bunch of donuts this morning. Whichever the case it is, we're all going to forgive ourselves for all that happened, and really kind of center ourselves for the next 20 minutes to really appreciate the body that we reside in and the heart that keeps that body going, and really how important it is to sort of acknowledge the mind, the body, and our spirit that comes together to keep us going each and every day. I'd like to start us off with a brief centering, which I call mindfulness, and it's just a minute long. So I want you to close your eyes and listen to this lady who is going to lead us through a wonderful affirmation meditation, but it's just a minute long.
Bringing light, taking just a minute, turning inwards. I visualize myself as a lighthouse, strong, firm, stable, spreading light in all directions, illuminating the way for others. I spread the light of love, peace, and joy, empowering others on their journey.
And this centering becomes so important to all of us as we've all walked through what has been an unforeseeable, unprecedented 2 years of the pandemic. And we're starting to see the end of the light, but we're still walking through it. So it becomes very important as that we continue to center ourselves in any little way that we can. And these 1 minute mind breaks really do that for me. So let's switch gears and kind of really take a minute to be awed and offer gratitude to our heart that really is doing all the work, regardless of whether we're awake or sleeping, whether we're stressed or not stressed, whether we're at work or not at work. But this particular little organ continues to do its work. So join me on this journey as we sort of appreciate, and it's such a beautiful way to look at it. It's a 3D animation that one of the companies has put together, and it's such a beautiful way to look at the heart. And I'm just gonna allow you guys to sort of soak in, the beauty of the heart that beats about 100,000 beats a day, manages to pump out 5 quarts of blood each minute, about 2,000 gallons a day. The female heart is about 8 ounces. The male heart is about 10 ounces. And our vascular system through which this wonderful organ, these are the valves through which the blood flows between the various chambers of the heart. And then from there, it moves on to the arteries and then goes on to the rest of the body. And did you know that our vascular system, which consists of your arteries, your veins, and your little capillaries, they roughly work out to about 60,000 miles. And 60,000 miles, and all of that is encased within your body, whether it's a 5-foot body or a 6-foot body or a 7-foot body, doesn't matter. But that 60,000 miles is enough to really offer that you can circle the earth twice. But what the earth also is, apart from the physicality of what it is, it's a wonderful electromagnetic organ. You know, you may have noticed that what we talk about as the vibe that a person gives as they walk into the room, what is it that we're sensing? We're sensing that electrical magnetic radiation that all of us give out, which we don't really usually think about. That pleasant countenance that somebody has, a smile that somebody has, that manages to create that vibe that we have. And that really is coming from our heart. And this is the reason why the EKG machine, you really don't have to put it on the heart. You can put it on your legs, your hands, to capture a whole picture of your electrical circuit. And the whole idea behind this is to let you know that the heart is not only a pumping mechanism, a pump, it's also an electrical circuit that works so intricately to give us the beats that it needs. And more we're starting to see how the mind, the body, and our spirit is starting to have an impact on our day-to-day existence. This is a recent article in the Circulation magazine, where they've actually first and foremost truly spoken about the mind-heart-body connection, how our psychological mind plays a role in ensuring that our cardiovascular health is in sync. And definitely what we put into it, the input that we put into it, whether it's through our senses or through what we eat, really has an impact on the output, which is how our body, whether it's in a state of ease or in a state of dis-ease. So let's kind of switch gear and talk about the physicality of the heart that we all know about. Blood pressure is something that a lot of you have had or struggle with or get checked when you come in to see a doctor. And that blood pressure is basically the pressure that the blood that the heart pumps out exerts itself on the artery wall. So when we do the blood pressure cuff measurement, we're actually measuring the intensity with which the pressure is felt against the artery wall. And if you guys know, and you should know, if you have been to see a doctor, that you should know where your blood pressure numbers are. And it becomes very important for you to know the numbers, because then you can do something about it. Typical normal blood pressure should be less than 120/80. If your blood pressure remains between 120 to 129, it's considered an elevated blood pressure. So this is just the body's way of saying, hey, do something about it. Maybe you want to cut back on your salt. Maybe you want to start exercising. Maybe you want to give up that cigarette. Once you start going into the 130 to 139 range and 80 to 89, that's when you go into stage 1 of high blood pressure. And this is kind of where we start worrying about your 10-year risk of having heart disease and stroke. And so lifestyle changes, medications, additionally can help bring those numbers down. High blood pressure is a diagnosis if they are greater, if the blood pressure has been above 140/90. And this is kind of where we start pumping you with more medications to help reduce the pressure so that your heart doesn't have to work so hard. And blood pressure machines, now there's plenty of them that are available in the market that you can monitor this at home, and you can definitely ask your physician to write you a prescription of it, because if you know the blood pressure that we check at the office is just one blood pressure reading in this point in time, but you want to know what your numbers are as you go through your days. And so even checking your blood pressure once or twice a week is a good way to know, hey, my blood pressure medications are working or my lifestyle changes are working. So all of this kind of helps to sort of give you feedback on what you should be doing. The other thing that we often check is when you do get blood work done is your lipids or your cholesterol levels. And the lipid panel usually consists of your triglycerides, which is what your carb gets converted into, your HDL, which is your good cholesterol, LDL, which is your bad cholesterol. And so you definitely want your LDL to be much lower, your HDL to be higher, and your triglycerides to be low as well. So let's talk about what does that look like within the physicality of your body. So cholesterol, a normal healthy amount all of us have and is needed because that's what makes up the cell membrane. But over a period of time, and partly because of the foods and environmental factors or familial reasons, we start developing, the cholesterol starts to collect in the walls of our arteries. And you start off with a small fatty streak between the layers of the artery wall. And then soon inflammation starts happening because it starts getting hit from other environmental factors, stressors, pollution, etc. So then what happens is that this particular cholesterol plaque can start becoming calcified because you've got a fibrous cap that develops. So now you're starting to see that the diameter of the artery should have been this whole length, but now some of it is getting filled up with this cholesterol. And then over a period of time, that cholesterol continues to, grow larger and could potentially become unstable to a point where some of it get flicked off. And this is what we call as a plaque rupture. And when that plaque ruptures, what you can have is a blood clot that develops. And when that happens in any of your arteries of your heart, that is what we call as a heart attack, meaning that there is not enough blood supply going to that portion of the heart, and that portion of the heart dies. Now, you may have a mild heart attack if it's a smaller artery vessel of the heart, or you may have a large one depending on which artery is getting impacted. So you could imagine how knowing what your numbers are can help your provider and yourself know what your risk factors are to develop a significant level of heart disease. The same thing along the lines of the vessels of the blood that go towards our brain. When those get occluded, you can have a stroke, and stroke leads to weakness in one side of the body, and blood pressure, increased levels of blood pressure can also kind of cause vasospasm of the arteries that provide blood to the brain. And that's why it's so important to keep your blood pressure and your cholesterol levels low. In those folks that tend to smoke or have developed a lot of cholesterol in the peripheral arteries, develop what we call as a peripheral vascular disease. And this usually happens in the legs of our arteries. So you feel like you walk, and then you have to take a break because your legs become very sore. Very different from the pain that you get from your lower back, but this is a very, very classic symptom that happens in patients that are smokers. So what the body does really is gives us many, many chances to fix ourselves before it says, I'm not going to do this work anymore. So really, by the time we get to the point of inflammation starting, it gives us many hits. It keeps rectifying itself. And that's kind of what we kind of take it for granted in our early teens, in our 20s, in our 30s, and by 40s, suddenly, voila, you feel like everything is starting to break down on you. But it's not breaking down, it's given you many hints, but we just haven't taken notification of that. So really lifestyle changes, and it's a reversible process in the early stages and doesn't require you to take medications, but if you do the right intervention at the right time. And really, and that's kind of what we call the diagnostic gap in the cardiovascular disease. It seems like body gives you many times to fix yourself, and if it doesn't, then we go into that state of dis-ease. So let's talk a little bit about what are some non-modifiable risk factors. And all of us have been, you know, all of us have to accept that to some extent. We all age. Our gender is pretty much set. Our family history and genetics definitely do play a role in this, because, and that's kind of why when you go to the doctor's office, often we ask you, you know, is there a family history of diabetes, heart disease, etc. So it becomes very important to know as much as possible about what your family history has been, so that you can take the proper intervention much ahead in the game. Race, and again, there's not too much that you can do about that. You're born into the family that you're born into. And really, the previous history. So if you yourself have had a stroke or a heart attack in the past, if you don't make the lifestyle changes, that risk factor multiplies itself. So let's talk a little bit about, you know, what you can modify, which we talked about a little bit, which is around the high blood pressure, which, you know, can be fixed and reversed if we do what is necessary to keep that going. And we'll talk a little bit about what you could be doing. Smoking, we know that nobody is required to smoke. It's a choice, and it's a habit that can be dropped if we want to. And we have shown, studies have shown considerably that if you do stop smoking, you do regain not only your lung function back, but also reduce your risk for heart disease down the road. Cholesterol, which again, we can fix by eating right, exercising, and taking medications if your numbers are really high. And regular exercise, some sort of activity that you could be doing, whether it's walking for 15 minutes, walking for 20 minutes, or doing some sort of even in-home exercises that you could be doing sitting in a chair, that just keeps your body's caloric intake lower, but because you're burning off the calories. And also it keeps the muscles going, and it also reduces this, increases your endorphin levels and reduces the inflammatory markers. So exercise is very, very important. Weight, and weight is partially related to a lot of the foods we eat, the lack of exercise, etc. And again, that's something, again, that can be fixable if we choose to do it. Diabetes is yet another lifestyle issue, especially type 2 type of diabetes. Type 1 is something that you're born with, so you can't make much of a modification on that. But type 2 diabetes is truly a disease of, you know, inactivity, of insulin resistance that develops just from being obese. So a lot of this is something that we can, I think all of you know this and have been spoken about too by your primary care doctors. So each day we have that choice. Do I choose the one on the left, or do I choose the one on the right? And there are days where you're gonna really say, oh, you know, I'm too stressed, I'm gonna go with the one on the left, which is the red one. And it's okay, you have to be kind to yourself at times. But if the more that we start to sort of move in the direction of the mindful eating, studies are starting to show considerably that it makes a heck of an impact on your health. So let food be thy medicine is something that Hippocrates basically talked about, you know, back in the Greek era. So, and this is something that we've come a full circle, where we moved away from foods that were natural, plant-based, and then we moved on to the processed food land, where everything was available with a 1 minute, you know, put it in the microwave and eat kind of food, fast foods, etc. And we don't realize that the chemicals that are going into it. And interestingly enough, the most simplest of things that come from the ground are sometimes the most expensive things. A vegetarian food costs a lot more than a a meat-based food. So it's mind-boggling. Part of it is just how the industries have sort of come about, but it's a choice. And what's fascinating to see, we're coming a full circle, that more and more people are adopting a plant-based diet and are seeing tremendous improvements in their health. Exercise is something that we talked about. You know, it's required. It doesn't need to be you don't need to join a gym. You don't need to, do some crazy levels of, workouts. 15 minutes, 15 to 20 minutes, if you can, give yourself that per day is plenty. And then you're going to work yourself up to about 30 minutes a day. But starting somewhere, getting off the couch, getting off your chair, getting off, the bed, whichever the case is, pushing yourself to even do that is so, so, so key. Nowadays, with the apps that are like blooming, you can do apps that are free apps that can, show you what to do, and you can kind of work along. Open Fit is one example that I can think of, and many of the other apps. If you go to the American Heart Association website, there's plenty of resources that you guys can plug into. Smoking, as I spoke about, it's so important, and it's so important for you, those that are listening to this call, to really be the change agents. Go out and tell other people to stop smoking, and it's never too late to stop. Reality is 20 minutes after you quit, your blood pressure actually goes down. I have plenty of patients that have a smoke and then they come into my office and I check their blood pressure and it's sky high. We wait, and then suddenly the pressure goes down. So it's so important that, because why? There's so many chemicals in this little piece of cigarette that is raising your blood pressure. It's a chemical that you're putting into your body day in and day out. 10 years after smoking, your risk of cancers decreases by 50%. 1 year of stopping smoking declines it to half the risk of heart disease. So it's legit. It's not a hocus pocus. You don't even need to worry about cancer, which is fairly long-term, but short-term impact is that you really reduce your blood pressure, and that blood pressure has impact, as we've already spoken about. And the multiplier effect is legit as well. So one risk factor can double your risk. Now, if you have two risk factors that are modifiable, you quadruple your risk. So learning and looking at yourself and sort of analyzing, hey, what are my risk factors? What are things that I can modify? What are things I cannot modify? If I have more non-modifiable risks that we talked about, then it is so important to up your game on reducing the modifiable risk, to reduce your risk of having heart disease. So in essence, if you think about it, heart disease is really, a lot of it is hurry, which comes from all the stress that we're living in, and the COVID pandemic pretty much proved that for us. The worrying that comes, so the mental health aspect of it becomes super important, and the foods that we eat, the curry part, which I just kind of threw on just because it just kind of all rhymes, hurry, worry, curry, and something that one of my teachers always used to talk about. So let's switch gears and really take 5 minutes to talk a little bit about mental health, because I think that's so key. And I think pandemic has definitely raised our awareness. Loneliness has increased, people's anxiety, stress levels have increased. We all spent about a good half of the year in 2020 not even coming out of our homes. And so that does create a lot of stressors in our body that raises our blood pressure, etc. So simple things that you can do at home is just simple meditation. It doesn't require 20, 30 minutes of it, even 5 minutes of you centering yourself and just watching your breathing. A simple breathing technique that you can do is, sit up straight. Let's try this together. Let's have all of you sit up straight. And I'll count till 1, 2, 3, 4. When I do that, I want you to take a deep breath from your stomach. So 1, 2, 3, 4. Okay, so then take a deep breath in and you hold your breath for 4 seconds, and then you're gonna let it go through your mouth. And you'll realize that this helps. So let's have you do 1 cycle. I'll count it for you guys just to make it understand what I'm talking about. So with the count of, let's have you sit up straight in your chairs, wherever you are. Put your hands around your abdomen area, and then close your eyes and I'm going to count till 4. So take a deep breath in. 1, 2, 3, 4. Hold your breath for 4 seconds. 1, 2, 3, 4. And then let it all out with 1, 2, 3, 4. Exhalation also has to be equally as forceful and as prolonged as your inhalation. What that does, you'll find, even if you repeat yourself for 4 cycles of this and do it twice a day, you notice that your blood pressure actually comes down. And these are studies that have been proven over and over again. And it also increases your endorphin levels and reduces your anxiety. So I'm sure if you are seeking any kind of behavior health counseling, your counselors must have even spoken to you about it. Like I said, justaminute.org has 1-minute guided meditation like the one that I played for you. It's something that you guys should really consider. Calm app is another one that you can use. And there are plenty of other apps that we can see as well. So just wanted to come back to the study that recently came out, which basically says, how, our behavioral processes that the shifts that we make has an improvement in actually numbers, not only lower blood pressure, lowers your cholesterol, and it decreases inflammation in general. And then also you see that, you are able to maintain better positive relationships. At this point in the game, oftentimes it's very hard to control our environments that we're in, but what you can control is yourself. And, and offer, when you're peaceful, the other person's issues sort of kind of become secondary. And it's very important, and I can vouch for this for myself, through the pandemic, having worked in the COVID stuff. It was very important to do this because burnout is something that I have truly palpably experienced myself. So I can only imagine, and I offer this as a tool for you to consider in your day-to-day living as well. And I think it is very important to sort of, in the process, also recognize that you, the person, is very important, and how you treat and what is your self-talk about becomes very important. The words that I use, I am, and what you put after that is a powerful affirmation. Every time you say I am and a positive thing, you're sending a message out to the universe, and that universe brings that back to you in that way. So I think that same idea that we're all vibratory beings. If you say I am sad, I am depressed all the time, you're going to have that same boomerang effect coming back to you. So one way to sort of think of yourself is to really have a gratitude journal where you can journal and say, what are at least 1 or 2 things that happened to me that were good, that I can really, focus my energy on, or one thing that happened good for my family that I can focus my energy on. But the word I am is a manifestation that you as a person can do for yourself, and allow for better things to come. And you may not see that immediate gratification, but over a period of time, studies have actually shown that within 6 months of you centering yourself, people's physical, mental, emotional bodies go through a lot of changes. So typically, these are all the barriers that we all struggle with. Oh, I don't have time. I don't want to stop eating the foods I like. I don't like exercising. Like I said, we're not asking for some major, changes, but just simple changes, and they can go a long way. It's very important for us to really think where we are emotionally. And if you're finding yourself super stressed, super anxious, super depressed, it's okay. It's okay. Acknowledge that, but seek help. Speak to your primary care provider about it. Seek counseling. Oftentimes we feel like seeking help for mental health issues is not something that we should do. And my problems are less compared to others, etc. I see a lot of resistance in that, but recognizing that, hey, if it's that whole idea of like, you have got to put the oxygen mask on yourself before you can help somebody else. So it is important that oxygen mask is you taking care of yourself, your physical body, your emotional body. And so there's seven simple keys to prevention, basically making sure your cholesterol levels are good, your blood pressure is normal, eating right, making sure you're working towards losing your weight, just moving and stopping smoking. These 7 things alone are enough to reduce your risk of heart disease in the grand scheme of things. So if I were to leave you with this advice, this would be my last slide here, is really for you to know your numbers. It's like know thyself is the statement that oftentimes in a spiritual parlance we talk about, that know thyself not only from the body, but also from your spiritual side. So, and your emotional side. So knowing your numbers requires you to know your weight and therefore your BMI. It's important for you to know your blood pressure. Ask your primary care doctor to set you up with a blood pressure machine. Cholesterol, knowing getting your blood work done once a year, knowing whether you're diabetic or not, so that can also change up your risk factors. If you are already having hypertension or cholesterol issues, making sure you're taking your medications regularly. I see a lot of patients that I keep refilling medications for, but don't take their medications. Your compliance is only going to impact you and your living, right? So it is important to sort of commit to your own self that you're going to make yourself better. Taking the medication is one step. And always recognize that both blood pressure, cholesterol, all are reversible. So if you get your numbers down, you don't need to be on these medicines forever. I've had patients come off of diabetic medicines, and some of them are present here. I've had patients who stopped smoking and I've taken them off their medicines. I've had patients who lost weight and I took them off of medicine. So it's very important that you're just doing this yourself. The medications are just a little bit of a crutch that you hold on to until you get your body right. But you hold the power to do that. Simple things you can do: meditate at least 5 minutes a day, like I said. Exercise, even if it's 15-20 minutes of walking, even in your lunch break if you're working. Oftentimes people say, oh, I don't have time, I have to drop off my kids, I have to cook, I have to do this. But you have to put aside some time for yourself, you know, everyone to themselves in that selfish way, to sort of make sure that you, the whole of you is, and each one of you that's listening to this is a valuable, important human being in the planet at this point in time. So don't let your self-worth, don't underestimate your self-worth at this point in time, more so than ever. Maintain a gratitude journal if that's for yourself, for your family. You'll recognize that good things start to happen once you start focusing on the positive. And honestly, in this day and age of where we're all staring at computers and everyone's getting, you know, cervical disc disease just by staring at their gadgets and devices, really get offline for 1 hour a day. If you're, you know, your smartphones are often telling you how many minutes or days you're spending on social media, etc. Social media is great, but it's also not so great because now you're learning about how everyone else is doing, then you're comparing yourself, etc. But that's unnecessary stress. Get off the media if you can. Consider switching to plant-based diet a few times a week if you're not already doing that. Why? Because it will increase your metabolism, it'll increase your energy level because you're away from processed food and you're staying away from animal products, which are, again, a lot of dead energy that's going inside of you. Stop smoking, reduce alcohol use. So simple things, little things, and they have, you know, rainbow effects of you doing that. So just recognize that. All right, with that, I'll stop. And
Thank
happy
you
to
so
have any
much, Dr. G. Listen, I just like to congratulate Dr. G for giving us a great presentation, guys. I think a lot of things that she talked about with the mind, body, and heart working together, these are the things that we should really think about. The spirituality aspect, the behavioral health aspect, a lot of things that she mentioned, these are things that we know about just in our own minds, but we don't always act on them. I think one of the she said many important things, but one of the most important things is the changing these lifestyle habits that we know contribute to our health, in a lot of cases, bad health. Understand that you can make changes a little bit at a time, just like she talked about. I have an old saying that says, how do you eat an elephant, right? And most of you know the answer, one bite at a time, right? You can't change what you've been doing for the last 40 years, 50 years, 25 years in 2 days. But you can change those modes of operation over a period of time. What you think about yourself and how you view yourself in the future are very important things. And one of the things I use is to view myself as being healthy as I get older in life. I want to be mobile and active for grandkids and all that kind of stuff. So the key thing is that make changes that's comfortable for you. All right. Again, Dr. G, thank you so much. That was very, very not only informative, but I think just the way you go about presenting the information and letting people know what the connection is between their mind and their body, I think that's a very key thing. The stress releasers, and for those who I think are very important, and also for behavioral health. Let's jump right in here. Do we have questions in the chat that need to be, that people want to get directly answered? Do we have some questions, Dr. G, that you're gonna look at in the chat?
I'm looking to see, like I'm scrolling up. Okay, hang on a second. Cannot hear you. Who's the speaker? Don't see slides. Okay, so there was a question, what is the best way to control your blood pressure? I think I kind of answered that in my presentation, but I'm not sure who asked that question. It just says from iPhone to everyone at 12:21. So why does it seem to affect people of color so much? I don't think it's specifically, it impacts, blood pressure is blood pressure. It impacts all colors. It doesn't matter whether you're Black, you're Asian, you're Caucasian. It's just that, our anatomies are different. For instance, in Asians, the coronaries are very, very thin. In African Americans, partly it's just the genetics of it. It's also the foods, the environment, lack of access to physicians and starting the medications ahead of time. Some of those are huge factors, especially in the African American population and in the Hispanic population as well. So I wouldn't say that blood pressure, spares the Caucasian folks. It impacts just about anybody and everybody. It's just that some are slightly more risk, just given access issues, equity issues, etc. So it is important to have access just about to everybody. Same thing, I would say for the other ethnicities as well. Which arm should the blood pressure cuff be placed, left or right? It doesn't matter. Usually I start off with, whatever is easy. If I'm checking it on myself, obviously it's easier to do it. If you are right-handed, then check your left. And if you're left-handed, check your right. Go to your non-dominant hand. Usually like to check it first thing in the morning, because technically the world hasn't come into you yet. So hopefully you're in a much more peaceful way of being. And so that gives you the most accurate number of where you are. And of course, if it's high, then repeat it again on the other arm. Now recognize that blood pressure is pretty dynamic. You may check yourself now, it's 130/80. You check yourself 1 hour later, it's 140/90. You can't really react to it. So what we're looking for is the mean arterial blood pressure. So what does your blood pressure look like over a period of a couple of days? So you can't react to one number, but you react to a series of numbers. Now, if your blood pressure consistently remains greater than 140/80, then of course you're gonna, react to it in a slightly different manner.
Okay, Dr. G, we have a person with a question here, Eva Triplet. Eva, you want to ask your question?
Can you hear me?
Yes.
Yes, we can hear you.
I wanted to know if I put it in the chat, but can albuterol raise your heart rate levels, your heart levels?
It does. Yeah, albuterol can raise your heart rate, and that's why we only recommend it every 4 to 6 hours. as needed. It's not something that you should be taking around the clock unless you have an asthma exacerbation or what have you. So albuterol is just but the rate at which the amount of time that it actually stays in your system is very short. So it's a very short acting thing. So you give yourself that pump, it stays, it causes your heart rate to go up. But within 1 or 2 hours, it gets rid of from your system. So, but for that period that you take it, yes, you're going to feel the heart rate go up.
Let's take a question from Renee. Looks like she's on her iPhone. Renee, you want to ask a question?
Yes, I've had a stroke. I had a stroke in 2016. I've lost 90 pounds. I'm eating healthier now. I quit smoking, quit drinking. Then I found out I had a TIA about a couple of months ago. And when I went to the doctor, they told me I had a hole in my heart. Now they want, yes, a hole in my heart. So now they want to repair the hole in my heart. They said, well, stop me from having stroke symptoms and, eventually having another stroke. So I know it's necessary, but a lot of people tell me they had hole in their heart too, but they haven't had the surgery. And I'm 61 years old. So what do you think?
I mean, I think every case is different, but just based on what limited things you've shared here, I do think that at 61, you're fairly young. So I think you can definitely handle the surgery. And if it reduces your risk of future strokes, because you can have an emboli that goes between one chamber of your heart to the other and go up. So yeah, if that's what your cardiologist is recommending, then I would go with that. Yep.
Yeah, that's what they're telling me. Thank you.
Great. I just want to say one thing here. Let's be careful with our questions. I mean, I don't mind asking questions, but sometimes we want to make it too personal because we want you to actually go in and see Dr. G, make an appointment with her, talk about that kind of detail, right? But go ahead and ask your questions. We got Lakeisha. We'll take a couple more. Lakeisha?
Okay, so I have a question. If your cholesterol level is, because I know the level is 200, but if it's 211, is that like bad?
Yeah, so the cutoff is 200 and you want it to be less than 200. That's kind of where we're, want to push you in the direction of. Is it super bad? It would depend on, how, if you're over 40, your doctor would have potentially, sorry, could you mute your line for a second? I don't know if you're able to hear me or not. Okay, thank you. So if you are over the age of 40, your doctor should also use an ASCVD calculator to plug in your cholesterol numbers to see if you're at risk for heart disease or not. If your heart disease risk is greater than 7.5, then they would probably recommend you starting on a medication. Otherwise, lifestyle changes is what they would recommend. So you would probably take that number that you have, the cholesterol numbers, and touch base with your doctor about to see, what your risk is for developing heart disease over a 10-year period. So yeah.
Okay, we're going to take two more questions. One from LUVN Indo.
Yes, hello?
Yes, go ahead with your
Can
question.
you hear me? Yes, I wanted to know, is an elevated C-reactive protein level of 16 directly related to heart issues?
So C-reactive protein is a inflammatory marker, and it's very non-specific unless it was like, you have to sort of take that into account with everything else, all of your other lab numbers, to interpret that whether it's, scary or not so scary, because you just can't base it on just that one number alone. And you have to sort of factor in what your other risk factors are to see if it needs to be reacted to. So I would just say that maybe take that up with your primary care doctor, your cardiologist, to see if there would be any additional information, because inflammatory markers can be high for a variety of reasons, not necessarily just heart alone.
Okay, we're going to take the last question from Beverly Stewart, I believe. Go ahead, Beverly.
Hello. Hey, Dr. G.
Hey.
I would like to know, is drinking coffee the same equivalence as a cigarette?
No, that's you stumped me, Beverly.
Yeah,
No,
that
that's a good one. But I
do them both.
expect no less. I expect no less from Beverly, so it's all good. So I think no, I don't think it's but it's apples and oranges really. One cup of coffee can raise is okay. 4 or 5 cups of coffee can raise your blood pressure and your heart rate. But I don't think smoking is a completely different ball game. You can't compare it to a coffee because smoking has other chemicals, associated with it that can have longer lasting impact on it. So, right back at you, Beverly. So no, the answer is it's not the same.
Okay. Thank you.
Hey, Conrad, sorry, there's 3 questions on the chat that I definitely want to touch base on. Somebody with the
Because we have to do our raffle and all that. So why don't you
kind
of hit them real quick?
Okay, the last question was around the postpartum and that they've been struggling to get their blood pressure right. So some of it, the preeclampsia is a condition that can happen with post-pregnancy. So one, you may have been on medications already during your pregnancy period, which probably should be continued. And you should have a postpartum check with your OB-GYN in 6 weeks after that. And if the numbers were still high, your gynae should have sent you over to an internal medicine or a family practitioner. So make sure that you do follow up, my friend. Besides the dietary changes, you may need to be on medications. All right, sorry, back to you. Mm-hmm.
I mean, did you want to address any others or just that one?
I think that was it. I think everything else I've gotten. Fatigue, a side effect of chlorothalidone, not really, unless you're peeing out a lot of fluids and not drinking enough water. That can cause fatigue. So make sure that you're drinking loads and loads of water if you're taking a diuretic, which includes furosemide, hydrochlorothiazide, and chlorothalidone. All right.
Thank you so much.
Sorry.